Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, we haven't done this for a while.
No, we took a little sabbatical for a couple, 3 weeks. So, yeah, let's get going. We want to talk about strokes. Okay?
Yeah.
And one of the problems with strokes after the stroke is balance. And I'm going to show you some balance exercises you can do at home after you've recovered. And this is for people who are already to the point, they're lucky enough where they've recovered where they can walk, but the walking is unsteady.
All right,
Okay?
fairly safe?
Pardon?
Are they fairly safe?
Fairly safe. Probably using a cane, and may not even be using a cane.
Okay.
They're higher level.
All right.
And you can do this for balance even if you haven't had a stroke. Okay?
Okay.
And you'll understand. It all makes sense as we get into this. So, you remember from school the 3 things that hold your balance, Bob?
Sure.
What?
Vision?
Yes.
Proprioception?
Yes.
Vestibular?
You've got it. Okay, we're gonna
I
tax.
wanna argue that.
We're gonna tax all those, and we do have a volunteer from the audience today. And
This is Callie.
Callie.
Callie, were you ever call her Karen?
No, Kayla.
Callie.
Callie, come on in. Sorry. Well,
Callie is a student, a junior undergrad for
yeah,
physical
face the
therapy.
camera there. Okay, why don't you stand here? Now, what I want you to do, this is first phase. You're going to bring your feet together so your ankles are touching. Now, some people may not get that because of your knees and your anatomy, but just bring your feet as close as you can. You're going to look straight ahead and you're going to cross your arms just like this, okay? And then, now if someone has poor balance, you may have to have someone on both sides. So Bob, you can stand
Sure.
there, and this is how you would be if someone's off and they're a little shaky.
Well, I would
so
say
to
maybe have a belt around them.
Yeah, we could even go with a belt.
Want to grab a belt?
You better believe it. So if it is someone that's come home from the hospital, you probably have a belt. Okay,
And this way, you can do it with one person then, because I know you're gonna have 2 people at home,
yeah.
so.
Okay, so here we go. And you're gonna do this for 30 seconds. The time isn't necessary, but we're gonna use a standard 30 seconds. And when you get this from the foam and dome test and the sensory organizational test, which is too scientific, but these are good quality balance tests
Sure.
and rehab devices used. So now 30 seconds, no swaying, everything looks good. Then you go to the next higher phase and we're gonna close your eyes. So that takes the vision out of the picture.
Right.
And a lot of times, and I know Bob and I have seen this a lot, where all of a sudden people start swaying when
Actually,
they
even
close their
Kaylee
eyes.
was swaying a little
Yeah,
bit there.
yeah. You out last night? Okay, all right. And you're gonna look at your watch, you maybe have your clock on the wall, and hold that for 30 seconds. If they're doing well with that, okay, the next thing is the proprioception. This is a knee pad I got from home. They recommend a 3-inch foam pad for the official test.
Okay.
But anything that's soft and squishy, and it's gonna throw off their balance, so you're gonna stand on this, okay? And you feel how that squishy makes things work a little bit harder, okay? And if they're steady with their eyes open, then their eyes closed, okay?
Now
And
she's
relax.
working a little harder too, you can see it.
Yep, you can see the ankles working down
Yeah,
here.
exactly.
Okay, now if you really want to get more official, the dome is what they use so you don't close your eyes, so your eyes are open and they're accepting information.
I see.
But the dome for me makes too hard to make, so the next best thing is take a pair of sunglasses, put some tape over them, and here, can you put those on? I don't wanna. And now she can keep her eyes open, so it's more relaxed and a normal sensation there, especially with someone with a stroke, may have problems maintaining eye closure, and this makes it easier.
What do they use for a dome, do you know?
Yeah, they baked this kind of a paper mache thing. It was
Not
way.
like a bag?
I thought about putting a paper bag over it. Okay, very good. So, the next step, if they're doing really well with that, okay, off here, feet together again. We're gonna start all over. Eyes open, close here. If she's steady here, and they probably are at this point, now you're gonna, let's go down here. You're gonna take your right foot and you're gonna touch with your toe right there. Now touch straight out to the side, bring it back to the starting point. And now see if you touch across and back to the starting point, and then straight behind you, back to the starting point, okay? So it's 1, 2, 3, 4, kind of like dancing, okay? But this is going to be harder, so you may have to hold on to that belt the first time they're doing it. If you have a cane, they might want to hold a cane. Okay, go ahead and do it. 1, 2, 3, 4. You passed it, okay.
He looks the hardest.
Yeah, now we're gonna go to this. Put these on, the next step up. Yeah, 3 going across.
Yeah.
Yeah, okay, go ahead, not quite, there you go. 2, 3, and she's still doing very good. Now let's make it a little bit more difficult in the same setup. I want you to reach out as far as you possibly can. You're gonna bend this knee a little bit and reach out really far and just touch your toe, go ahead. Touch, way over. Wow, she's got great balance. And back,
Now,
okay.
you know what, make her do it the other side.
Ah, good idea, Bob.
Let's
Let's
see if
tax
she's as
her,
good.
let's tax her
People,
balance.
yeah, see, she's already in more trouble. People tend to go to their dominant foot
Yeah,
first.
see, she's kind of,
Yeah.
there you go.
So even
Ah.
on a normal individual, you'll see that they have one side that's better than the other.
And this is where therapists
Yeah.
really start to have fun. Let's go with this, Bob. All right, here we go. This is the ultimate on the foam. We got the dome, the eyes covered, and now let's do the same thing. Reach out with the right foot. There you go. Look at
This
this
is
left
hard.
ankle work.
And this is where you're definitely gonna have someone holding on to you.
Yeah. Oh. And you do have to be careful on the foam if they have a weak ankle.
Right.
You won't want to do it because you could roll it.
You'll turn it.
Yep. Okay. Now do the other leg. We might as well be complete.
She's getting smarter on that one.
Now, how old are you?
9 or 20.
She's 20 years old, healthy young 20-year-old,
Yeah.
and that gives you a baseline for that. But if you have someone after a stroke, you probably won't even get to the
Get to the
foam.
foam.
Yeah, so you go by the individual's potential, be safe, have a belt on them, 2 people if needed, and it's a great exercise. Okay, you want to sit down? You can sit down with us to finish off. All right.
All right, thanks a lot, folks.
Subscribe again, okay? We'll show you more of these insightful
Yeah,
tips.
just keep
Wait,
subscribing.
Yeah, look at this though.